awareness, if we can call it, I will try to answer 5 questions. The first one is, what is lean? And the second one is, what is not lean? The third one is, what is new in lean? And the fourth and most important one, what does Tim Wood wastes mean in lean methodology? And the last one, how can you start? If you are a staff nurse, physician, surgeon, whoever, technician, pharmacist, how can you start to grasp the idea of lean? Okay, so the 15 slides will be answering these 5 questions. So what is lean? If you will be able to grasp the idea or recognize the current picture from our current processes in the left side with the full of fat to the lean process or the target or the aim that we want to reach or to get after implementing lean is to remove all the waste from the process. Our current process also mixed with different areas in different departments. So our patients are not happy to move from point 1 to point 2, crossing all over point 6, 3, and 5. We want our process to be in a sequence, moving from 1 to 2 to 3 to 4. Okay, this is applicable, of course, for medical processes, for nursing procedures, in labs, in pharmacy, in technical affairs, medical supply, wherever your processes should be reprocessed again and redrawn to be in a very clear and sequence accordingly. Okay, so if we want to define lean in a very, simple way, it is a process of continuous improvement. It is not one step, and there is no end for this improvement. It is a continuous improvement. If we can reduce the waiting time in the emergency room by 30% from 6 hours to 3 hours, then we need to aim for further improvement in the next project after finishing this, the current one. So it is a continuous improvement. This continuous improvement aiming to identify and eliminate waste. When we are saying waste and keep saying that eliminating waste, we are not talking about the physical waste in the garbage, but we are talking about the non-value added activity. All non-value added activities in our processes are considered to be waste. Okay, so what are these non-value added activity? This is the Tim Wood waste. Tim Wood is an abbreviation for T for transport, I for inventory, W for waiting, O for over-processing, and the second O is for overproduction, and D for defects or errors. So these are the waste we aim to remove from our processes. Lean is about removing the waste or the non-value added activity from our processes. So if we take an example of dispatching a medication in pharmacy, okay, the non-value added activity in that particular process could be defects, errors, giving medication, wrong medication to a patient, or giving whatever type of mistakes could be happening. So we are talking about the D here. Then the waiting time that the patient is waiting to get his medication. Actually, our patient, who is a customer in the other industry, is not concerning about how you are performing your process. He is concerning about how to get the service at the end product. Do whatever you do, but do not let him wait, because the wait, as per Lean, is considered to be non-value added activity. Then mistakes that will lead to call a physician by the pharmacist, okay, to make sure or to confirm that this medication is not the correct one, will lead to waiting. Waiting is considered to be non-value added activity. We will take an example of how the triage could be full of waste as it will go. So this is what lean is in a very simple way. What is not lean? Lean doesn't mean that we need to work harder than what we are doing. It is not working faster even. We are not talking about to accelerate the work to work faster. No, we are talking about reprocessing. Remove whatever you can remove from your current process. Remove the non-value added activities. Non-value added activities mean all the team wood starting from transport and ending to defects. Okay, lean is not about eliminating people. We are trying to reprocess to get more time for other prioritized business or things that you need to concentrate on. Then it is not a collection of tools where you have it in your hand, then you will go to fix everything. It is not. It is a culture, a cumulative culture in the hospital. We are not here in the operations committee, lean operational committee, to give a quick fix or as a response to cost reduction program. Of course, at the end, we will be able by removing non-value added activities to reduce some cost, but the purpose is not to reduce the cost at the beginning. And our results may delay because we need to build a culture, and it is a new program that will start, and it will take time to get. Okay, so this is what lean is not. What is new in lean? 5 things or 4 things. It is a small scale improvements versus big project. When we are talking about lean project, I know most of you have gone through a chance to in a lean project in different areas, and they have heard about that. Lean is not about 5 years strategic planning project. It is about a project could be finished with pilot study in 2 months or up to 6 months. Some of the lean project could be even done or completed less than that. So lean is about finishing the things less than 6 months, not like other quality initiatives that will, for example, if we want to improve the quality of Sultan Qaboos University Hospital, it is a big project. Lean will take a process that is happening, process of admitting patient in ICU, process of conducting or finalizing this one forms in procurement department, process of dispatching medication in outpatient pharmacy, process of admitting patient in OPD, and etc. So each process will be concentrated or will be taken as only project, and regardless the department that it will go. Some of the processes will start from emergency, going through cath lab, going to OT, going to admission, medical ward or surgical ward, then to pharmacy, then to labs. All these people should be involved at somehow in the project that aim to improve the process. The second point, which is new in lean is a time bounded. We know that if we want to improve the procurement process or the payment process in finance directorate, we know from today, which is February 2nd, that by April 3rd, we will finish this project. So everything should be agreed upon the team, including the sponsor and the champion, that project will take this much of time. Then also the third important point that is new in lean, it is a small steps. Deliver results earlier than one big project, because these people will lose their momentum if they will be asked to conduct a project for 2 or 3 years. They will not see results. Then they will be frustrated that no quick wins. They cannot see the fruitful of their project. Lean is about delivering results than when conducting one big project. The fourth point, which is new in lean as well and could be also available in other quality initiative, is the improvement identified by workers. Okay, who are these workers? They are the process owners in lab, technicians, and the people who are doing or processing cells, the improvement or solutions or proposed countermeasures will be proposed by them. They will be involved to draw the value stream mapping, identify their problems in that particular process. They will create or suggest proposal solutions for that. They will prioritize that. They will suggest or they will conduct a pilot study, and they will sustain their solutions or their results. So involvement of everyone who is involved in the process, because you are the best one as process owner in your area. The surgeon is the best one who can reprocess how to do the operation, starting from receiving the patient from the surgical ward till he will be from the recovery to the ward again. Staff nurses who are involved in operation theater should be involved in drawing that process to identify again the non-value added activities in that particular process. The last point is eliminating non-value added work versus optimizing value added work. Around the globe, our process efficiencies will not exceed 25%. Tell me a process, then I will tell you this process efficiency will not exceed 25%. This is as literature stated. So our area or our likelihood or probability to succeed in lean implementation is very high, because we have 75% of the non-value added work that we need to invest in. Okay, we have issues, so we have our investment likelihood will be very high. So this is like something or a vision we need to invest in 75%. Okay, so this is what is new in lean. This is our third question. Okay, this is an example how the patient could be triaged in emergency department. What is the purpose of this slide? I want to show you what is the efficiency of this particular process. It could be a process of dispatching medication, performing a procedure in daycare, administrating chemotherapy in OBD, medical OBD, wherever. So what I want to show is that these are the processes or steps that a patient will be triaged through in emergency department. He will be coming, driving, parking his car or her car in the parking area. Will take 10 minutes from him, then he will enter the building, then 2 minutes for registration. Just to let you know that the green area here or the green rectangle here are the value added process. Out of the whole steps that you can see here, only what is value added here is the green one. When the patient will be registered in the medical record, by the medical record, when he will be examined or X-ray or whatever digital will be done for him. Then when he will checking out, will be seen by staff nurse triage, or when he will be seen or diagnosed by a physician. At the end, only what is valuable. Remember, we are talking about value added and non-value added. The value added process from the whole story or from the whole process is only 27 minutes, which is representing 16% of the whole process. So the remaining steps or the remaining percentage is only non-value added time. We have two types of waste in this process. Waiting is the most or the big or the huge waste that we can invest in this area. So for example, if I am a project champion in emergency, what I will do, I will see the timing. Where is the patient spending more time? He will be here waiting in lobby to be seen by a physician. So what I need to do, very simple. I will not recognize or I will not, waste my time seeing other things. Just I will invest my team efforts to reduce this 80 minutes to some time, the maximum time that I can. Then the value added time will be increased. and the non-value added time, that including waiting and transportation, will be decreased. Okay. So in general, our fourth question, what does Tim Wood waste mean? Tim Wood is, as BDO mentioned, that it is T for transport, I for inventory, and we have issues in inventory. Hopefully we'll be able to see that. Waiting, what is the difference between transport and motion? Transport is moving the service to the customer, to the patient, while motion is movement of a healthcare providers in our hospital to perform their services to our customers who are the patient. Waiting, we have a very long list of examples with waiting area, waiting in emergency, in OBDs, in pharmacy, radiology, clinical physiology, getting lab result, and so many examples. Overproduction, overprocessing, and defects. We have defects in terms of errors happening in the hospital. Okay, so in our hospital, maybe if we can prioritize the waiting could be in the place number 1, and overprocessing in place 2, inventory in the 3rd point, and defects or errors in 4th point. Okay, we have some examples. Waiting, patients waiting to collect their medication from pharmacy, as I have mentioned. Employees waiting to get an approval for their new grade. HODs waiting to finish the procedure of his or her new employee. And directors waiting to get DG's approval. These are examples of waiting waste that could be eliminated or minimized by some of you who are attending here. Because if you are from pharmacy, you will be able to do something in the process you are owning. If you are from radiology department, you will be able to reduce the waste, the non-value added activities in the area or in the process you are owning or doing or performing or providing to patients. If we will be able at SQH to reduce or implement lean, we will be able to reduce the timing or the waiting time by 90%, according to lean thinking authors, as they have implemented the average time in different industrial areas. Okay, in over-processing area, we have example of access procedures to evacuate a retired party, then access procedures for approving a new medical department, redundant procedures for changing a job title, access procedures for reviewing financial contracts. We have so many other examples. If we implement lean correctly at maybe after a few years, then we'll increase our productivity by 50% because we will remove or eliminate the over-processing steps from our processes. For inventory, we have furniture storage in the main store of the hospital, storage of medical materials in hospital wards, in child health, surgery, wherever, one blue, one yellow. Storage of valuable medicines in the pharmacy. We have so many examples of that. If we can do that, also we reduce the inventory by 50%. This is also including the equipments that are stored in the corridors, equipments and materials that are expired in our storage area in the main store and the sub-stores as well. In defects or errors, we have examples of investigating errors in the auditor's grievance, error in auditing financial documents, error in conducting medical examination, and error in completing statistical employees' data. If we can implement lean carefully and correctly, we will reduce our errors by 50%. Okay. Some authors, they will focus on the human potential as the waste number 8. Tim Wood are 7 waste. Human potential, like losing the habitual or losing the people with the intellectual, thinking, the people who can provide their areas with ideas or with the new concepts, not listening to employees, people habitually working below their level of ability, write stuff at wrong places. This is considered to be waste as well number 8, as stated by some authors. Okay, my last slide, how can you start? This is like a short introduction. How can you start in your area? You are a physician, staff nurse, technician, working in admin area, wherever in the hospital, you can start at your area by trying to think that what I have to, how can I reprocess my own process? Actually, lean is also can be taken to homes, to your car, to your area. I mean, it is implemented in industrial area, in services area, in banking, manufacturing, wherever. It could be also implemented in your own home, at your own services providing. If you are your own business, no worries. But how can we implement it in our hospital? Which department you are from? You are from medicine, daycare, radiology, from pharmacy. Nevertheless, what process do you have in your area if you are from medicine? Admitting patient from emergency, dispatching medication, performing MRI, administrating chemotherapy. List all of the process that we are doing or performing in daily basis. It will be very, very long list. Okay, so these are the processes. Then what type of teamwood waste does this process have? Okay, you have a process, you are performing your daily job. How can you identify the non-value added activity in this particular process? How can you identify the non-value added activity? By concentrating in the 7+1 waste, waiting, over processing, and defects. If you will be able to grasp that particular waste, then you are in. Your mind has been shifted to think about lean thinking. I think this is what I have. I made it very short. Hopefully it will be very sweet, and we'll leave the floor now for question